Hi, Tan Sri. Just wanted to ask, do we have enough reagents to keep up with all the testing that we are doing now? How much stock do we have left? And the second question is, why do some people in Sabah have to wait a few days to be admitted to hospital even though they've tested positive for COVID-19?
Okay, thank you for your question. So we are looking into the reagents so far. As far as we are doing RTK antigen as well as RT-PCR. So if you can see that in Sabah, our capacity is 2,600 RT-PCR can be done daily. And we also outsource to the private sector and also transport the sample to IMR and MKAK in Sungai Buloh. So we are actually assisting Sabah to do the testing. That's one. So we have enough reagent in terms of the planning forward. And in terms of RTK antigen, we have actually shifted more than 100,000 RTK antigen a month. So we will continue to increase the capacity for testing. And more importantly, public health intervention will continue in Sabah and to detect more cases, especially the cluster. About 40% of cases come from the cluster, and also will increase the surveillance in the community. So that's what we have been doing, and we hope that we can bring down further the RT that is from 2.2 to 1.5 now, and we need to bring it down to less than 1. So that's our target now. For the next 4 weeks, we must bring the RT right from 1.5 right to less than 1. So I hope that we can get the collaboration from everyone for us to comply to the SOP. And the message to the public is stay at home if you do not have any urgent matters outside. And the admission, yes, we do know that because the results comes back a bit late. Some of the results been sent earlier. The waiting time was about 3 days. So now we have tried to cut down the waiting time, and in terms of the backlog and etc. So we do have initially a backlog, but now we have cleared the backlog. That's the reason why we see the sudden increase of the cases, because we have cleared the backlog. So once we have cleared the backlog, so we hope that it will be timely that the result will be back, and our staff can trace those positive cases and admit them to pusat quarantine and rawatan risiko rendah or to the hospital.